another big issue is that there has been no looking at what did or didn't go wrong to the COVID-19 response. This is basically a quadrupling down on that response, and it supports more gain-of-function research, not removing it. So it's very hard to see that it is directed at eliminating pandemics.
Well, judging by what you say, it sounds like there is actually an incentive for the WHO, for its partners, to declare a pandemic and to then authorise the use of public money to be poured into private health bureaucracies and health companies such as Big Pharma's production of vaccines. After all, if there's no public health emergency, you can't justify the use of billions of dollars of public money into a vaccine company. So that is a concern. And there's other concerns too, such as having bespoke solutions to problems. We saw Sweden took a different approach and they were pressured by the WHO to come in line and they didn't. But other nations who wanted to take a different response, they were bullied successfully into not doing so. I mean, all of this is not positive. So I'm wondering, have you seen any Australian ministers actually acknowledging that it's important for Australia to maintain its autonomy in the health industry and to make sure that we do have the freedom to go against, for example, a bad idea put out by the WHO?
Not any of the ministers currently in power anyway. Obviously, there's a very small group of senators and ministers in Parliament that are very much against this and are working very hard to try and make sure it doesn't become an eventuality for Australia. But in the ministers that are in control of Parliament at the moment, there is full support. Penny Wong gave another $100 million to the WHO in the last month, which doubled our contribution for the year. Within the what's called the PPP manifesto, which the WHO approved on the 20th of September in the USA at a UN meeting, despite the protestations in writing of 11 member nations, there is a request basically for the WHO to be given funding which is in excess of 5 times their current annual budget just for pandemic preparedness. So that's just the start of the request for funds. And yes, within the amendments, there is multiple clauses about equity and providing provision for health response from more able nations to third world countries.
Yeah, you're right. There's a whole stack of paragraphs in there that talk about the notion of equity and making sure that the money from the Western world is used to fund a whole lot of undescribed and ill-defined ventures in the third world, no doubt to the benefit of the private companies who are hanging off the side of the WHO. When you read the whole thing, it feels like an appropriation of public money under the guise of public health without much plan about what to do or how to go wrong. There's also, I noticed, no funding allocated to, I don't know, vaccine side effects or any kind of harms that might have been called or anything like that. Now, is there anything that viewers can actually do to help your cause? Because what I'm finding is people are alarmed by it. They would like their ministers to be across it more, but people feel like they can't do anything.